If you're a student and you're on placement and you hear someone having a STEMI or an NSTEMI and you're unsure what the differences are, let's go through it really quickly. When someone's talking about a STEMI and an NSTEMI, it basically means they're having a heart attack. So a STEMI means ST elevated myocardial infarction and an NSTEMI means non-ST elevated myocardial infarction. So an MI, like I said earlier, means myocardial infarction, which in simple terms mean that the patient is having a heart attack. This means reduced blood flow to the heart, and the risk factors are smoking, obesity, high cholesterol, and in particular your LDLs, and a poor diet. There are plenty more risk factors for you to look at as well, but I recommend you have a look at those in your own time. The symptoms of a myocardial infarction, aka a heart attack, the obvious one is chest pain. You'll have patients coming in and sometimes they say they have left-sided chest pains and it'll refer down their arms or jaw. That's a big alarm bell that you want to raise to a doctor. Shortness of breath, fatigue and dizziness, a feeling of impending doom which can feel very anxious for the patient, pale, clammy and weak. The difference between a STEMI and an NSTEMI is quite simple. In a STEMI, there's a complete blockage of blood flow in the heart, which is usually caused by plaque, so the blood is not able to get to the rest of the heart. You'll have your raised biomarkers in both a STEMI and an NSTEMI. But on a STEMI, in your ECG, you'll have an ST elevation and it'll look something like this. In an NSTEMI, the hint's in the name, it's not going to be an ST elevation, and sometimes it'll show as an ST depression like this on your ECG. In an NSTEMI, you'll have a partial blood flow because you'll have plaque attached to the side of the artery, and it'll reduce the blood flow to the heart, meaning it's slowly getting starved of oxygen. If you have a patient that comes in with chest pain, the very first thing you want to do on them is an ECG to rule either of these two out, because there's a lot of causes of chest pain and it's not always a heart attack. So you'll also want to do a blood test on them for troponin, and this is a protein that's in the heart and it's released into the blood when a myocardium is damaged, which is the heart wall. So you'll do that and you'll wait for the results and you'll get your ECG escalated to a doctor. That's just a very, very quick explanation of the main differences between the two. So I hope that helps, and there's a lot more to learn. So keep learning, keep doing your revision and you'll learn lots more.